So I've been looking at the census data, and there's 12% black, Asian and minority ethnic people in our area. And yet when we look at the statistics for who's accessing the service, there are only 4% from BAME communities. So my question is, are we properly serving those communities? Is there anything more that we could be doing?
I am worried about my son. He has nightmares, and sometimes he acts in a way that I don't know how to handle. He doesn't always want to go to school or even leave me, and I don't know what to do about that or who to talk to.
Well, I've heard that CAMs in some areas have already been going into faith places and community centres run by people from the BAME communities. Maybe that would make a difference, if we started to do outreach into specific communities and maybe look at how we can work together. What do you think, James?
Definitely worth looking at.
Our daughter's been cutting herself, and I know there must be some places where we can get support, but we've just no idea where to turn.
But what if people think it's because we're lesbians and that's why she's hurting herself?
I don't care if people think that. We just need to get some help. She needs some help. We can't just let things go on as they are.
Okay, so if we're going to do this properly, we need to look at other communities. Okay, so what about parents who are gay, lesbian or trans? What more could we do to raise our profile with these groups, and how can we target them?
Have you any thoughts on this, Matthew?
Yeah, we could contact some LGBT organisations. I know a few different ones. We could contact those through social media. Good.
Right, well, let's make that an action point. And Kath, you're definitely right about approaching other communities as well.
They say my grandson's got special educational needs. I'm not surprised he gets really down and angry a lot with all the grief that he gets. You see, his mother couldn't even cope with him, and that's why he's living with me. But I need help.
My son's adopted. He's consistently in trouble at school, and now he's in trouble with the police. I get sick of the way people demonise him. He's an angry young man who needs help. It's not his fault, the dreadful background he's had. I don't know half of the things that happened to him when he was younger, but what I do know is bad enough. I don't know where to turn or how to get the right help for him.
I mean, what are we doing to reach parents who adopt or people who are fostering?
I think we need to be a lot more visible within all these communities.
Well, I think we could start by updating our posters and leaflets. We could create ones that are more representative of different communities.
I think we need to talk about opening times, general accessibility, language barriers.
Maybe we could look at other CAM services that address these concerns. We could learn from them.
Well, I think we need regular updates, and we need to monitor the success of the various initiatives. I mean, the team needs training. It's too important to neglect. And the service is about all children and young people who need our service.